Just say no. We all have or have known someone who drove under the influence of alcohol or drugs. It isn't about seeing how many times we can do it until we get caught. Driving under the influence is defined as operating a vehicle while affected by alcohol or drugs. Alcohol is the leading substance when it comes to DUIs. Most people believe to get a DUI one must be drunk. However, that is not the case. The blood alcohol content is what determines whether or not the driver is driving under the influence. If the driver is 21 years and older, it is illegal to operate a vehicle with a blood alcohol content of 0.08%. A driver younger than 21 years old with a blood alcohol content of 0.02% is considered to be drunk driving. Many people believe that alcohol is the only substance associated with a DUI. However, drugs also play an important role. Driving high is just as dangerous as driving drunk. Driving under the influence of drugs is a little more difficult to prove when stopped by the police. The police look at erratic behavior as a sign of drugs. If the drug is marijuana, the officer may be able to smell the drug. However, the only way to prove that the driver was under the influence of drugs is to do a blood test at the emergency room. For example, a police officer may pull over a driver for failure to maintain lane. After approaching the window, the officer notices the driver's bloodshot eyes. The officer can do sobriety tests, but in the end, the officer must take the driver to the police station to determine if the driver was driving under the influence. DUI may refer to either the influence of alcohol or drugs. Regardless, it is an impairment caused by the consumption or use of either while operating a vehicle. Next time you have a couple beers or smoked a joint, think about the risks you are taking when you get behind the wheel of a vehicle.